Doug. My name is Shona. I'm a registered nurse and I specialize in cardiac and pulmonary care. And I now work for Hospice of Marion County with the special programs and the telehealth. And I have come to bring to you today the telemonitoring system. This machine is absolutely awesome. It allows you to take your vital signs on a daily basis at a specific time that's good for you in the morning, preferably about an hour after you take your medications. And what we're doing with this machine is we are going to be monitoring your heart rate, your weight, your oxygen level, and your blood pressure. And all of that information gets downloaded into the computer through the telephone line. It gets sent to my computer in my office, and I'm able to look at your vital signs to see if there's any changes that might need to be alerted to your doctor.
Okay.
So as part of the interdisciplinary team between your case manager, your doctor, and myself, we're going to be looking at your information and helping you to have the best quality of life that you can have at this point.
Very good.
So what we're going to do is we're going to do a demonstration of the machine, and I'm going to walk you through it and allow you to get some experience in how to use it, okay? So the very first thing you're going to do is you're going to hit the retest button.
Okay.
When you do hit the retest, it's going to ask you if you want to do a complete set of vital signs. You're going to say yes, and then the machine is going to prompt you to do the rest of the walkthrough.
Okay.
It's going to tell you exactly what you need to do, okay?
Okay, ready?
So go ahead and hit the blue button.
Okay.
If you would like a retest of a complete set of vital signs, please press yes. For a partial set of vital
Hit
signs,
yes, Doug.
please press no. Good morning. It is now time to record your vital signs. Please step on the scale.
All right, Doug. Just watch your step.
Please step off the scale. Please sit down on a chair in front of the monitor. Place the blood pressure cuff on your right arm, above the elbow. Tighten it securely.
Okay?
Okay.
You need to make sure you always have a bare arm when you're doing this, because this machine reads the vibrations in your arm as opposed to sound.
Okay.
Place the finger sensor on the middle finger of your left hand, with the finger design facing up.
There's the finger design right there, Doug. Just
Okay.
need to make sure that's on the top and it's securely all the way inserted into your finger.
Okay. Good. I think I can do that.
Rest your arm as instructed by your clinician. Press the green Start key.
There,
Here.
yes, sir.
Okay.
You can hit that button. There you go. That's going to start taking your blood pressure. After it takes your blood pressure, it's going to announce all of your vital signs. It gives you an opportunity at the end of this to write down, keep a record for yourself. All of the information is sent to me, so I will have a record at any time if you ever needed to know anything. At the end of this machine is set up to ask some specific questions for your specific diagnosis concerning things that may be abnormal for you for the day. So when it asks you the questions, Doug, you need to just make sure that you're answering it specific to this day, within the past 24 hours from yesterday to today. What's happening when you answer yes or no to these questions, they also get sent to me and I'm able to look at this information.
Okay.
When I see that you have answered yes to something, at that point I will probably call you and find out what is happening, and then we can take it further, whether we need to call the doctor or whatever the case may be. So when this machine's finished, you'll be able to understand what I'm explaining to you with the questions, okay? So it usually takes a little bit of time to read your blood pressure, so we'll
Okay.
just wait it out.
Please remove the finger sensor and the blood pressure cuff. Weight 217.5. Heart rate 47. Oxygen content 94. 151, bar 78. Please answer the following questions using the yes and no keys. Are you experiencing more difficulty breathing today compared to a normal day?
No,
Are you having any pain?
no,
Have your ankles been more swollen than usual?
Yeah, they look pretty good.
look pretty good.
Mhm.
No,
Have you been having any new numbness or tingling? Have you developed a cough?
no,
Have you had a fall in the last day?
no,
Have you been having any chest pain?
no,
Are you having any headaches?
yes,
Please remember to take your medications as prescribed by your physician and maintain the proper diet. Thank you for completing your vital signs measurement.
At this point, Doug, this little it's like a satellite,
Okay.
this picture is actually transferring the information you just
Mhm.
inserted into the machine, into the computer system, allowing me to read it. It's in real time, so it's actually within a couple of minutes, I will be able to see your information. And at that time, when you had answered the question yes to headache, then I will probably be calling you within the next minute or so to find out what's happening and find out maybe the source of why you're having a headache, whatever it might be related to, your blood pressure perhaps or whatnot. So this is the machine that's gonna be coming on daily for you, and we're really, really excited to have you aboard on this program and able to do the best that we can for you. So,
I think I can do that.
you think you're gonna like it?
I think so. So I had open heart surgery 6 months ago.
Is that right?
And I do have high blood pressure, so, and I do take medication for my, blood pressure, so this will be great. I'd like to see those numbers too.
Yes, sir. It helps you in empowering
Right,
your own self
exactly
with your
right.
own care and be able to monitor things
Sure
and,
does.
and kind of remind you to make sure you're taking your medications and making your doctor's appointments and all that.
I like it.
Well, welcome, and thank you very much.
Thank you.